Do you have to run to the bathroom all the time, even though you've hardly drunk anything? Maybe you think that's normal. But what if your body is sending you a serious warning signal with that? If you recognize yourself in this scenario, stick around and watch this video until the end. It could change your life.
Welcome to Endovision with Dr. Berger, your leading channel for insightful perspectives in the world of endocrinology. Here, we highlight the central challenges of our time: diabetes mellitus, obesity, thyroid disorders, and the essential role of nutrition for a healthy life. Subscribe to Endovision if you are ready to take your health to the next level. Here begins the path to a healthier, self-determined life.
Polyuria, or excessive urination, is much more than just an annoying problem. Often, there's more behind this symptom than you might think. Hormonal imbalances, kidney dysfunction, or even diabetes can be serious causes. Don't panic. We'll uncover the causes together and help you take the right steps. Polyuria describes excessive urination that goes beyond the usual amount of 1.5 to 2 liters of urine per day. But where's the line between normal and concerning? In adults, we refer to polyuria when the urine output is 3 liters or more per day. Important to know, polyuria is not an independent disease, but an alarm signal. Behind every symptom, there can be numerous causes, and it's important to identify them. A common cause of polyuria is excessive fluid consumption. Caffeine and alcoholic beverages have a diuretic effect. If you drink large amounts of water, tea, or coffee, your urine output will increase significantly. Keep that in mind. What you drink has to come out again. Certain medications, diuretics used in treating heart and kidney diseases, cause polyuria. Lithium for bipolar disorders and depression also causes this. And some diabetes medications like SGLT2 inhibitors, such as dapagliflozin or empagliflozin, can increase urine output by promoting more sugar excretion. Poorly managed or untreated diabetes mellitus is a common trigger for polyuria. When blood sugar levels are consistently high, the body tries to get rid of the excess sugar through urine, which leads to a significant loss of water. Anyone who frequently feels the urge to urinate should definitely check their blood sugar levels. An extreme form of polyuria is diabetes insipidus. This form of diabetes has nothing to do with blood sugar, but rather affects the hormone ADH, antidiuretic hormone, which regulates water reabsorption in the kidneys. A deficiency or malfunction of ADH leads to an overwhelming urge to urinate. Despite its rarity, diabetes insipidus should be taken seriously, as the consequences can be severe. The urine output can sometimes be as high as 10 to 15 liters a day. A hormonal imbalance can also trigger polyuria. An overactive parathyroid gland can disrupt calcium balance and cause an increased urge to urinate, because the body wants to get rid of the excess calcium. Other endocrine disorders, like a misregulation of the thyroid or adrenal insufficiency, can also lead to this. Chronic kidney diseases affect the kidney's ability to regulate fluid balance. This can especially lead to increased urine output in the early stages of the disease. Don't just pay attention to the amount, but also to the quality of the urine, like foam or blood. It can indicate kidney damage. In heart failure, fluid can accumulate in the tissues during the day. This shows up, for example, as swollen feet and lower legs. At night, when you're lying down, the heart can pump better, and the stored fluids are increasingly excreted through the kidneys, which leads to frequent nighttime urination. The hormone BNP, or brain natriuretic peptide, is produced in heart failure, also promotes water excretion. Excessive drinking due to psychological reasons can lead to polyuria. Here, we're often dealing with emotional causes that require targeted psychotherapy treatment. Even without psychological causes, excessive drinking can lead to symptoms that require a thorough examination. A urinary tract infection can usually cause frequent, scanty urination. In severe cases, however, the urine volume can increase. Watch out for symptoms like fever, pain, or blood in the urine. Immediate medical evaluation is necessary here. In some cases, polyuria is harmless, like after a night of dancing or on hot days. Alcohol consumption also leads to an increase in urine volume. It becomes critical, however, when accompanying symptoms appear. What about constant thirst despite adequate fluid intake, or unintentional weight loss, fatigue, or nausea? Foamy or discolored urine can indicate the presence of proteins or other substances. If these warning signs appear, please don't hesitate to seek medical help. Polyuria can be a visible symptom of a serious condition that needs treatment. The first step in figuring this out is a thorough medical history. How much do you drink each day, and how often do you need to go to the bathroom? Do you only need to go to the bathroom more during the day, or also at night? A 24-hour urine collection can help determine the exact amount of urine. Blood and urine tests are important to rule out possible causes like diabetes, kidney diseases, or hormonal disorders. The treatment depends on the underlying cause. With diabetes mellitus, consistent blood sugar control and dietary adjustments are crucial. In my video series about diabetes mellitus, we go into great detail on that. Check it out. Medications or hormone replacement can help with endocrine disorders. For example, if ADH or cortisol production is disrupted. Sometimes, however, surgery is necessary, for example, in cases of parathyroid gland disorders. If it's medication-induced polyuria, you should discuss it with your doctor, whether a change in medication or a change in your behavior makes sense. In the case of psychogenic polydipsia, psychological support is the top priority. The amount you drink should be gradually reduced. Here, a detailed drinking history is necessary to gradually reduce the fluid intake by 250 to 500 milliliters per day until you reach a normal range of fluid intake. No matter what the cause is, an early diagnosis and targeted treatment are essential to avoid long-term consequences. Polyuria might seem like a minor issue at first. Having to run to the bathroom all the time is annoying, but who really thinks much about it? But as we've seen, this symptom can be a serious cry for help from your body. Whether it's diabetes, kidney diseases, or hormonal imbalances, polyuria rarely happens for no reason. Don't ignore these warning signs. If you notice signs of polyuria, seek a doctor immediately. Your health is worth it, so keep your eyes and ears open. If you feel like you constantly need to go to the bathroom, particularly accompanying symptoms like excessive thirst, weight loss, or unusual changes in urine should raise a red flag for you, then it's high time to seek medical advice and get to the bottom of the issue. If you liked this video or found it helpful, please give us a thumbs up, subscribe to the channel, and turn on the bell. That way, you won't miss any of our new episodes on exciting health topics. If you've noticed any other symptoms, my other videos might be for you. Also interesting. Feel free to share this knowledge with friends and family to help them to better understand the signs their bodies are showing. Thank you for your interest, and see you in the next video. Stay healthy.